Good afternoon, everyone, or good morning if you're on the West Coast, and thank you for joining us today. We're excited to bring you the second webinar in the NIA Data Linkage Program's 2025 webinar series. Today, our featured presentation is done by the Panel Survey of Income Dynamics team. Next slide. The agenda for today's call will start with a few brief introductions and webinar logistics, followed by a short overview of the NIA Data Linkage Program, which will then lead us into our featured topic, the Panel Survey of Income Dynamics offerings. At the conclusion of the presentation, we will hold a question and answer session. By way of introductions, I'm Susan Seifert, the Program Director of the NIA Data Linkage Program. I am joined today by Esther Friedman and Nora Insolera from the Panel Survey of Income Dynamics. Given the webinar format of today's session, we're asking that you submit your questions in the Q&A box, which can be found in the lower navigation pane in the area if you hit the three dots. A screen will pop up and you'll see the Q&A chat box. The panel will do their best to answer all of the submitted questions, time permitting. Should there be any remaining questions, our team would be happy to follow up with you via email following today's session. Next slide. Now for a quick overview of the NIA Data Linkage Program. NIA established the linkage program to address three major challenges that researchers face relative to gaining access to the CMS data for linkage to study data. The first challenge is the time and cost for researchers to access CMS data. To overcome this, NIA collaborated with CMS to structure this program in a way that is able to provide quicker access to CMS data without the researcher incurring any data fees. One condition, however, is that researchers must use the CMS-linked data in a federally authorized system that complies with many federal data security requirements. Finally, NIA recognizes that not all researchers are experts in the use of CMS claims data. The linkage program offers knowledgeable CMS data support staff to assist researchers in the use of the data. Building on these challenges, the primary goal is to facilitate high-impact research in the area of health and aging while minimizing the cost of data. Next slide. Our comprehensive CMS data inventory includes Medicare enrollment data, Parts A, B, C, and D claims data, CMS assessment data, which includes MDS, OASIS, and IRF-PI, and we also offer access to Medicaid data. Next slide. The CMS and study data is delivered to the researcher in the linkage enclave, which is a set of secure workspaces where researchers are able to analyze the CMS-linked study data. Each project gets a dedicated project environment, which is accessible to only authorized members of your research team. Next slide. The linkage enclave offers a variety of statistical software packages such as MATLAB, Python, R, SAS, SPSS, and Stata. The enclave also features a proprietary tool called the Job Board, which is a load-balanced, high-speed server farm which can be utilized to run your statistical programs, often in substantially less time than running the programs using local resources. Next slide. The enclave features a file transfer tool that allows the transfer of files into and out of the enclave. Importing files is generally restricted to code and supplementary files as approved by the study team. Export requirements are aimed at supporting the dissemination of your research findings and are a little more restrictive a little bit more strict in that data exports should be aggregate level data containing no PII, PHI, or small cells. All export requests should be in presentation or publication ready format, meaning no intermediate results will be reviewed for transfer out of the enclave. Also, data transfers out of the enclave require independent review by both the NIA data linkage program as well as the study offering access to their data. The linkage program offers a three-pronged support structure. The linkage contractor offers access to and support using CMS data as well as wide support using the enclave. NIA supports the researchers not only through its support of the linkage program, but also through the NIA DUA review process and approval process to access CMS data. Of course, each study team offers their expertise of their study data and associated support. Team can be accessed either through email or via phone, Monday through Friday, 8 a.m. to 8 p.m. Eastern. I know this has been a very, very short overview of the NIA data linkage program. My team is always happy to take any questions following the presentation or via email later as questions pop into your mind. But now, without further delay, I would like to introduce the panel survey of income dynamics team to continue today's presentation.
Thank you, Susan. I'm Esther Friedman, and I'm going to be co-presenting on behalf of the PSID study with my colleague Nora and Solera. You'll see a few other PSID panelists on. I think we have Malak Kalasho on right now, and we may have others join as well later to help with the Q&A portion of the study. The way we're going to divide up the talk, Nora will provide a brief overview of the panel study of income dynamics, and then I'll take the second part of the talk and discuss the Medicare linkages in particular. Next slide. So this is just a brief overview of what we'll cover. As I mentioned, Nora will cover the introduction to the PSID, and then I'll talk about the Medicare process, specifically the linkage process and the characteristics of our linked sample, the availability of data in the enclave. I'll give you an overview of the application process. We saw a little bit of that from Susan already. I'll discuss how to use linked data in the enclave, including some examples of ways the data have been used before and new things, new ideas for using the data. And then I'll tell you a bit about how to get started and what we have planned for the future. Next slide, please. And Nora will take it away with the introduction to the panel study of income dynamics.
Hello, everyone. I'm Nora Insolera. I'm the Assistant Director of the Panel Study of Income Dynamics, which we lovely refer to as the PSID. No cute word comes out of it, but we'll be referring to it as the PSID from here on out. So the PSID, what is it? So it's the longest running nationally representative of the United States longitudinal household survey in the world. And essentially, we have our main interview, which is what we'll be focusing most on today, and it collects information on individuals and families, both over the life course, we've been around for over 55 years, and across generations. And so we have quite a breadth and depth of information that we collect on. And I'll go over pretty briefly here, but just to give you an idea of the types of information that we collect. And then, as we said, Esther will continue on to discuss exactly how you can link the two together. So in addition to collecting information from these core families on employment and income, wealth, health, family formation, family composition, and other items like philanthropy and education, we have a lot of information on health and well-being, especially that has expanded over time, I'd say in the last 20 or so years, but since the study's inception in 1968. Additionally, additional data that you can connect to all of this core data that we're going to be focusing on here are our ongoing supplements. So we have information on children who are age 0 to 17, where we have actual supplements for them specifically, and that look at children and their primary caregivers. And then also the transition into adulthood supplement, or TAS, that looks at individuals who eventually will be these core respondents in our core PSID study, who are between the ages of 18 and 28. And so we're able to kind of follow kids through young adulthood and then finally into adulthood when they join the PSID study itself. We also have one-time or somewhat regular supplements that Esther will discuss a little bit more that focus on disability and well-being and childhood circumstances that for one way or another don't seem to fit quite right, whether it's timing or who we want to talk to into the main study, so we collect them as modules or supplements. Okay, next slide, please. So as I said, the PSID started in 1968, and it was founded at the University of Michigan by James Morgan. So it came out of the Survey of Economic Opportunity, which was a study that was looking at an oversample of Black families and families who were sort of vacillating around the poverty line at that time. And then Jim Morgan said that he would take on this project and continue it for 5 years, taking that sample of the SEO sample and adding in a cross section of the United States at that time. And so those two samples started our 5,000 American families, so it was technically a little less than that. And that 5 years has now turned into over 55. We're currently in the field collecting our 2025 data. Okay, next slide, please. So the PSID has a genealogic design. And so when Jim Morgan took over this sample in 1967 and started fielding it in 1968, he had this brilliant idea that has paid in generations and generations of data by saying that the original individuals in the PSID study would have what we call the PSID gene. And so the children of, and the descendants of the original PSID sample keep the gene themselves, and then they will be eligible when it's time, when they split off and have their own independent households, to become PSID sample members themselves. And so in this way, we were able to keep national representation because of the refreshment, the natural refreshment of the study over time. And so there we have our longitudinal design, where we've been collecting data for well more than 5 years at this point. And then also the multi-generational design, where the children of the original sample members and their children and their children and their children, and in some families up to 7 generations who have participated in some way in the PSID since its inception in 1968. There are some individuals that we do miss, though, by this sort of natural refreshment model. And those are people who've immigrated to the United States since 1968. And so to sort of keep our national representation, we do periodic immigrant refresher samples. We did this in 1997 for those who had immigrated between 1968 and 1997, and then again in 2017 for those who had immigrated to the United States between 1997 and 2017. And so these two things together allow for us to have ongoing national representation for the PSID study. Next slide, please. So we currently, 57 years later, have 43 waves of data that are collected through 2023. We're waiting on the very final pieces of the 2023 data to arrive, and then we will be releasing those data. Right now, there is an early release file available on the website with the publicly available full files available from 1968 through 2021. So we have over 9,200 original or descendant active family households in 2023. And as I said, we're back in the field now in 2025, doing a similar collection to what we did then. So we have over 84,000 individuals who were ever observed in the PSID, meaning that we saw them in a household or they were reported on in one of our modules. And here we have over 88,000 variables just for the core. So this is for the variables that are available from all 43 waves of data. If you go to our supplements and our kind of supplementary modules, we have well over 100,000. Next slide, please. So how does this work? So many longitudinal studies sort of work in different ways. The way that we've been most successful is that we have a respondent who is our informant on the family, and they sort of represent the family unit and they answer all of these questions. So because of this, there's some information that we ask only the respondent as an individual themselves, and a lot of other information that we can ask of the entire family unit as a whole, or most often we have very detailed information on that individual spouse or partner. We collected information yearly, so annually from 1968 to 1997, and then started a biennial collection starting in 1997. So you'll see now that our fieldwork periods are in the calendar years that are odd years. But we do collect information not only on the current year, but of the previous calendar year. So most things you're able to still look at on an annual basis, though we do collect them biennially. Originally, we knocked on doors and had a sampling distribution that we worked from. And the interviewer sat in living rooms and asked the questionnaires on pencil and paper. Now that transitioned over time to telephone interviewing, to computer-assisted telephone interviewing, which is that CADI since 1993. And just in 2021, so 2 full waves ago, we started this mixed mode web and CADI data collection. And so families can do a web instrument, or they can complete via telephone with one of our interviewers in person, or not in person, live on the phone. The typical length of our interview in recent waves has been about 80 to 85 minutes. So you think, how could you possibly get 88,000 variables from these individuals over time? And it's because we do have a pretty lengthy interview. Next slide, please. So we've said that we talk to these individuals and about their family units. And so what kind of information do we collect? So this is just a real quick snapshot to be able to kind of look at the types of information that we collect. So not necessarily the variables themselves, but the types of information we collect and how that has kind of changed over time. So when you see a solid line, that means that we've collected at least some type of information about that topic. And then sort of the bubbles are showing where there's large kind of content changes. Typically, we're not asking less. Usually they're expansions of content that we're collecting. And then you can see sort of in that teal or turquoise color that, starting in 1997, there's some information that you may not see completely because we switched to the biennial design. But as just one example, we have the expenditures, which is 3rd down on the list in purple. So we've always collected some information on expenditures like housing and food. But then in 1999, there was a very large expansion, again in 2005. So instead of just being able to kind of look at some kind of snippets of expenditures, you're now really able to look at full consumption of these family units on an annual basis. All right, next slide, please. And these slides will be available afterwards. This is kind of going through it quickly, but all of these resources will be there for you. So this one is sort of looking at sort of added core interview content over time. And so instead of sort of looking by topic, this is sort of giving more of the calendar view and sort of seeing what information was added over time. So still by topic, but you can see some of the information sort of have these little dashed outlines, meaning that it was something that was new in that year, or that it was something that we were going to collect once, twice, or maybe continually depending on the interest in the topic. So some areas are just expanded areas of interest, like the philanthropy module that we've collected since 2001, and other things we just didn't have them, right? So we couldn't have collected data on COVID-19 before our 2021 wave because COVID-19 didn't exist yet, right? And so you can see that, being a longitudinal study, you have certain information that you collect year after year and try to stay really consistent. And other things you really have to be malleable with the world around you and add content sort of when it comes up. And then, of course, decisions are made as to whether that content stays or adapts or expands over time. All right, next slide, please. So something that we had a feeling that you all might be interested in today was the health content that's in the PSID main interview. And so here we have the year that it was first collected. Nothing here has been discontinued. There are some things over time that perhaps we have collected in different ways. But something that's really interesting to look at here when just talking about health is that we've kind of had a gradual expansion over time. And so if you look at this timeline here, you can see it's not just in one specific year we decided health was important, but really this gradual expansion of content, moving from some of the earliest information that really was more maybe income dynamics focused, looking at employment and work trajectories, with a little bit of behavior, health behaviors and things like that. But really to the expansion through the 80s and 90s, adding in things like exercise, general health status, height and weight, and then the activities of daily living and instrumental activities of daily living. Go to the next slide, please. But there was sort of a larger expansion in the 1990s through today, really, looking at health conditions, a myriad of different health conditions, when they started, how they're treated, health expenditures, again, in that sort of expansion of the expenditures, was a lot of health expenditures information as well. So when you're around for 55, 57 years, you become an aging study. And so some of the topics that aren't necessarily as important maybe in the first few waves, when you have a huge sample of individuals where a large proportion of them are aging, some of these things become much more frequent and much more interesting to our interviewers or to our researchers. And then sort of in the most recent waves, we have things like medication use, the AD8 dementia screener, and as I said previously, lots of information on COVID-19. And so at the very bottom here, we have the Medicare claims data that Esther will discuss. And so we did start collecting Medicare numbers starting in 1991, but this sort of reboot of the accessibility of these data is really something that is quite remarkable and I think is going to really help to expand research in this area. Okay, next slide, please. So I'm almost done here and I'm just going to touch briefly on some of the health content things here. So this is kind of, instead of talking about sort of broad strokes of the entire study, this is some of the stuff that's collected today. So in the current health content. So we do have self-reports. Some things are collected only for self. Mostly those being emotional well-being and mental health. Other things that are collected for self-report and proxy report, and that's everything else on this page here. So looking at specific health conditions and their histories and how they're ongoing, and then other things that are more general, like general health status. All right, next slide, please. And then in addition, we have kind of some that are more event-based, right? So not necessarily a retrospective fitting of something into our prospective study, but things like health insurance, healthcare coverage, limitations that you might have for work and other reasons, hospital visits, and then also health-related safety net and transfer programs, the participation in those types of programs as well. And so we sort of run the gamut on not only the income related things, but really the specifically either public health or health related for individuals and our families. And so with this next slide, I'm going to hand it back to Esther to discuss the Medicare linkages specifically in the PSID context. Thanks so much.
Great. Okay, thanks. So now you know a lot about PSID data, and I'm going to talk a bit about how you can link it and what you can do with the Medicare linkages that are available. Next slide. So as Nora mentioned, PSID was an early and one of the first national panel studies to link to Medicare claims data during the 1990s. In 1990, Medicare eligible respondents were asked to give written consent to link 1 year of claims data, and then consent was renewed annually from 91 to 95. Then there was a brief hiatus in the linkages, but the process resumed again in 2005. And Medicare eligible respondents have been asked for consent to link their data each wave since then. The most recent linkages that we have available for PSID respondents right now are through 2021. That's because the 2021 wave of data is our most recent publicly available wave of data. But we have plans to update each wave. So as there's a new wave of PSID data, we plan to link to updated information in the enclave and make everything available to users. Next slide. So really the first step in this whole process is in the survey side and on the respondent side. So we determine eligibility, who's eligible to be linked for consent, and I'll talk more about that in a minute. And once we decide that, we need to get consent from our respondents before we're going to go any further. So we do have a question in the survey that we ask. It's changed slightly over time. But we say we'd like to learn more about people's health and how healthcare is used. The best place to get this information is the Centers for Medicare and Medicaid Services. So we're therefore asking you to let us, use these records. And we let people know that it's voluntary, that it won't affect their benefits in any way. And then we ask respondents if they consent to linkages, yes or no. And then we also ask for their Medicare number. And that, combination of information allows us to link our respondents. Next slide. So these are the criteria we've been using for eligibility for linkage. And what I have listed here is eligibility for linking in the 2021 wave. So sample members need to meet one of the following 3 criteria in order to be eligible for linking in 2021. Either they were ages 65 and over, between our 1991 and 2021 waves. So we do link cumulatively. So going back to 1991. If they were less than 65, they need to have reported receiving Medicare. So that is a survey question where we ask about the receipt of Medicare. If they received Medicare between 1999 and 2021, they are also considered eligible, even if they're under age 65. And then we also look for people who are 65 and over when they died and have a year of death between 1991 and 2021. And taken together, this is our sample of eligible individuals, eligible for linkage. Next slide. So not everybody who is eligible was sent for linkage, and there's sort of three main reasons people might not be sent for linkage. The first is if we didn't ask them for consent, and that could be for a variety of reasons. Sometimes they attrited from the study too soon, or they just weren't present during the right years. There are also people that we ask for consent, as I showed you before with our consent question, but they don't provide consent. We do not send them on for linkage. And then there are people who consent, but they don't provide the information we need to link them. So for instance, we do require the Medicare number from people who consent to linkage, or, we have other kinds of identifying information. If we don't have it, we don't send them on for linkage. So overall, about 40% of that eligible sample that I mentioned was sent on for linkage, and this is in 2021. And we're doing some analyses now to see how different they are from the 60% who are eligible but not sent for linkage. So these are some preliminary results, and we'll have more final analyses posted on our webpage in a technical report pretty soon. But so far, what we're seeing is that the sample that's sent is pretty comparable to the eligible sample on gender, but we are seeing some differences based on the PSID sample membership. So Nora had mentioned that people can kind of enter the sample in a few different ways, and race as well. We're seeing some differences, specifically that white adults are slightly overrepresented in the sample that is sent for linkage compared to the eligible sample. And we're still looking at some other sociodemographic factors so we can understand better about who we're missing from these linkages. Most of the people who are sent for linkage do link to the CMS data, 97%. So, the vast majority of those sent do link. And that gave us a sample in 2021 of 3,666 people aged 65 and over. Some are still alive and still in the study. Others were 65 and over at death. So we have records for them as well, and we have PSID data for them, but obviously, since they've passed on, we don't continue to, collect data other than linked data. And we have about 500 respondents who linked who are under age 65 as well, but were receiving Medicare. We, again, have been doing some analyses to see how different the linked sample is to the not linked sample. And we're finding very similar things, actually, to the sample that was sent compared to the eligible sample. We're finding that they're pretty similar on gender, the linked and the not linked, but there are some differences by sample membership, as well as race, with white adults being slightly overrepresented in the matched sample. Again, these are preliminary results. We're still working on them and still looking at some other factors, but that information will be available soon for those who are interested. Next slide. Okay, so now we know the who, who's in the sample, who's there. This is the what, what is available. So at first I have listed here the availability of PSID data in the enclave. And as you can see, there's a lot of data that we've made available in the enclave. These are all publicly available data sets that you can also find on our website. The first set of studies that are available in the enclave are our family level files. So that's files with information provided wave by wave. There's also consumption and expenditure data and wealth data. And importantly, for people who are interested in intergenerational relationships or linking family members, we also have the family relationship matrix and the family history files. We've also moved over our individual level file, which has person level information going all the way back to 1968 and merged into one very large data file. So that has a lot of rich information on individuals in the study. Nora briefly mentioned some of our supplemental studies, and I'm not going to get into all of it here today, but we do have studies that we collect regularly, these supplements such as the Child Development Supplement and the Transition into Adulthood Supplement. Those are available in the enclave as well. And then there are supplements that we collect less frequently. So the Disability and Use of Time study, was a study of older adults and disability, and included time diaries as well. And we collected that 2 different waves. Those data are available. There's information on childhood retrospective circumstances, well-being and daily life. That actually includes other cognitive information for those who are interested, and that was collected in 2016. And then the family roster and transfers module has rich information on intergenerational transfers from parents to children, from children back to parents, and that was last collected in 2013. And these will be, some of these data are collected again periodically if you're waiting for more recent data or interested in looking at that. Next slide. And then there's a variety of CMS data available in the enclave as well. These are the data sets that are available right now and the years that are currently available. As I mentioned before, as we have a new wave of PSID data, we'll match to whatever the most recent years of data, CMS data, are available. So this keeps getting updated as we have new waves of PSID data. And the data that are available are the Medicare enrollment data, Parts A and B claims data, Parts C and D data as well, the Medicare assessment data. And even though we're limiting the linkages for now to Medicare eligible population, we also have Medicaid data on those individuals. Next slide. So you heard a little bit about the application process already from Susan. This goes into a bit more detail. And basically there's 3 stages to the application process. The first step is sending a whole bunch of information over to us at PSID. So you'll need to prepare a CV, a research plan with details about the analyses you plan to do, IRB approval for the study, and then there's a specific link data request form so we know what data you're requesting. Once you get all this information together, then you can submit it to PSID. The second stage is when PSID reviews the application. So PSID will look over what you sent, hopefully grant approval pretty quickly. Sometimes we might have to get back to you about things that aren't clear or need to be changed, and then there's an opportunity to revise. But once it's approved, then you're sent a data access agreement. The user signs this data access agreement, and then PSID notifies the user of their approval by email, CCing linkage and the NIA privacy board. The third and final stage is when access to the data are granted. Linkage will first send an NIA data use agreement for signature. The NIA privacy board will also issue a DUA, and linkage will create a workspace in the enclave and let us know at PSID that they've done so. And then PSID will provide access to PSID data and crosswalk files that are already in the enclave, but will provide access to the specific files that were requested, so not necessarily to everything. And linkage will grant access to the CMS data and work on onboarding the user as well. Next slide. So once a user has access to the data in the enclave, the very first thing to do is merge the CMS data to the PSID public use data. And the way to do this is through these unique IDs. So PSID public data, any PSID public data, the individuals are uniquely identified by the combination of the 1968 ID and the person number. And PSID respondents who have data in the enclave are assigned an additional ID. So they have this pseudo ID number, which you can find in the crosswalk in the enclave. Individuals in the CMS data, on the other hand, are uniquely identified by their beneficiary ID number. And those data also have this sort of pseudo ID. So what you want to do is use the crosswalk. The crosswalk has the pseudo ID. So you want to use the crosswalk to link to the CMS data and link to the PSID data, and then merge everything together so that you have individual level matched data. Next slide. Okay, so data are matched, lots of data are available. What can you do with these data? Now, I'm sure a lot of the people joining the webinar today have a lot of ideas already. So I'm only going to give one example, an early example of how some of the merged data can be used, and then talk more generally about the kinds of things that can be done for people who are still thinking about how to best use these linked data. So back in the 90s, Lillard and Rogowski had a study on supplemental private insurance and the relationship between Medicare costs, specifically whether having this supplemental insurance increases Medicare costs. And back then they used the 1990 health supplement to the PSID and linked to Medicare data to assess whether supplemental private insurance increases Medicare expenditures and the magnitude by which it does. They used measures of expenditures for Medicare covered expenses that were available in the linked data, specifically from Parts A and Parts B. And what they do is show that private insurance is actually, or was back then in the 90s, a key part of financing healthcare for older adults. So I guess the reason I'm showing this older study here is to give you a sense of what has been done, but it's also an opportunity to update these kinds of analyses now that we have linked data over a longer period of time. It's possible to now look at changes over time and the significance of supplemental private insurance in funding healthcare costs for older adults with Medicare. And we also have, as Nora showed, much more updated PSID health information that can be used. So it's nice sometimes to see these older studies and what can be done and think about how can we apply this to the world today and using more up-to-date information from PSID. Next slide. And there are a lot of other things that can be done with the data as well. This is a really valuable aging-related resource that provides additional information that you can't get from the PSID study itself. We have now more than 30 years of Medicare data on healthcare use and spending, and more than 40 years of prospective life course measures on economic and social well-being from PSID. So the kinds of things that can be looked at with these linked data are, a lot of it is over the life course information. How does early and midlife, social, economic, health, and even environmental factors influence later life medical care utilization using CMS related data? Can also think about, instead of the life course, think about comparing different birth cohorts, which we have in the PSID because we've been collecting data for so long. So how does healthcare spending compare across birth cohorts? So, an earlier cohort and a more recent cohort. Do we see differences? What about generations of families? One of the unique features of the PSID is that you can compare parents and children. And once the data are linked, you can compare all kinds of utilization and spending information for parents as well as for children, and see how has this changed with time when you think about fathers and sons at the same ages, mothers and daughters at the same ages. What does healthcare spending look like for the Medicare population? Next slide. Okay, so hopefully you're all running out now to get started using the linked data. There's a little, few steps to take before you can get started using the data. The first step is to look at our application webpage and get an overview of how to apply. We have this really nice graphical overview. I think you'll be able to click these links later once you get the slides. If not, you can find it on the webpage. So for people who are more visual, you can see a picture of the application process and how it works. I think I had mentioned when I mentioned the analyses that we're working on a new technical report that will provide some more information on the linkage process and on the data themselves. But right now we do have a technical report from 2014 that can provide some useful information as well. The new report should be available within the next, hopefully several months or so, but the 2014 report is already up there on the website now. The linkage webpage is also a really great resource for learning more about Medicare claims data. So I'd suggest that that's another place to go if you're thinking about getting started. And the first step in the application process, as I mentioned, is to pull together materials and submit it to PSID. You would submit it to this psidhelp@umich.edu address. If there are questions with application materials, or you're not sure what to provide, or if you need something, that email is also the place to go to ask questions about this process. Next slide. Okay. So now I just want to give folks a little sneak peek on what's coming. So I mentioned that you email your application materials as a first step. We've been working on a web portal for the application process that should be available very soon and will simplify the process so it can be submitted right there through the web. We're working on updated documentation. The process changed when we moved over to the linkage enclave, but we also really haven't done an investigation of the linked versus not linked, some things I've talked about in a while. So we're updating our technical report on the PSID linked CMS data, and that's forthcoming as well and will be posted online as soon as it's available. We're working on updating data. So we'd mentioned that everything's available through 2021, but the 2023 core PSID data and documentation will be available in June 2025. So within weeks, hopefully. And linkages will be available shortly thereafter through the most recent year available. So as soon as the data are ready, we are going to submit it for linkage and see who else links now. We're working on providing more data as well, specifically more restricted PSID data. We've been exploring making geographic data available and other restricted data. As I mentioned, the data that I showed for PSID are all publicly available data. There's a sort of extra steps in getting the restricted data available. If that's something that's of interest, don't just wait. Let us know, because if we know somebody's waiting for it, sometimes we can move more quickly, or at least we can give you an ETA or some more information on when it'll be available. So please do reach out if you're interested in the geographic data or some other data that aren't already on the enclave. And finally, we have plans to link more beneficiaries. We've been focusing on the Medicare eligible population, but we have plans to link the Medicaid only population in the future. This won't be for a little while yet, because we would need to get consent from this new population, but we're hoping to incorporate that in a future wave of data collection so that we can have even more beneficiaries available for analysis. And this is just a few more useful links. There's some really useful information, some videos, and you might even recognize, I think Nora's voice might be on some of them, but getting started with PSID. There's a nice introductory video, learning about the documentation. We have videos of that as well, and of course the documentation is on the webpage as well. That's a link to the PSID Medicare data request process and this technical report that I've mentioned a few times. And once the updated report is available, it should be in a similar location to the older report. So you should be able to find that fairly easily as well. And I think that's, well, let's see, next slide. I think that's what we've got here. Yeah. So if there are questions, again, psidhelp@umich.edu is a good email address to write down if you have questions about the PSID study or the linking process. And of course, we're ready to answer questions now as well. Thank you.
Thank you, Esther, Nora, and Susan. To any attendees, if you have questions, please add them to the Q&A component. If you need to access the Q&A, typically in the navigation pane in the bottom right of your screen, you'll see 3 dots to the right of the chat button. If you select those 3 dots, it says more panels, and you should be able to access the Q&A by selecting it from there. We'll give everyone a couple of minutes in order to add any questions you might have. In the meantime, I'm just going to cover some frequently asked questions we typically get. So as we mentioned, we will be sharing a copy of these PowerPoint slides with you all after today's session. We'll send them out via email. If you, for some reason, don't receive the email, please contact linkage support and we'll be able to send you the slides. There will be a recording of this webinar component, just essentially the PowerPoint session that was presented. It will be hosted on NIA's YouTube playlist at a future date, and we can provide an email to the attendees once that has been uploaded in case you want to, review, take a look back, see anything that was discussed during today's session. Another frequently asked question we typically get is if there are any fees associated with accessing the data. There are no fees for accessing the PSID linkage-CMS data in the linkage enclave. NIA covers the costs associated with this. Again, just highlighting some key things. So the first step to request the linked PSID data is, of course, going through PSID, completing their request process. Once that's done, you will work with Linkage. We'll assist you with completing the NIA request process. At that point, the NIA Privacy Board will review your request. If approved, you'll be issued an NIA data use agreement. And then once that's fully executed, we'll work to onboard you into the linkage enclave to actually access and work with the data. So those are some key kind of things to keep in mind. I don't think we've had any questions come in yet. Let's see. We'll wait another minute or so to give individuals time to add in questions. But as we mentioned, we know there was a lot of information covered today, so please feel free to reach out to the PSID team by their email address. or also to the linkage team for any questions. We're more than happy to assist with questions in regards to the request process, request materials, things like that. So we'll hold another minute or so for any new questions.